1 second was left on the time clock during the Iron Bowl versus Alabama and Auburn. The game was tied, and Alabama had the ball. Alabama was just going to kick a field goal for the win. So what do you think that Auburn did? They huddled. They came up with a game plan, they worked as a team, and they won the game. Auburn caught the ball from the missed field goal and ran it back 100 yards for the touchdown. How did they do this? Because they had a plan. So everyone, let's huddle. Teamwork divides the task and multiplies the success. My goal for this change project is to incorporate effective delegation and communication in a busy emergency room. My objective is to accomplish this goal is to initiate a short daily huddle meeting before the start of each shift. There are multiple areas that are suffering in our department due to poor communication. Management, delegation, lack of motivation, teamwork, accountability, and patient outcomes. Managers do not let their voices be heard. No one is delegating or being delegated to. The team is burnt out. Teamwork goes by the wayside because we have no plan, and chaos is the definition of our days. When people are given tasks, no accountability follows to ensure things are being done accurately and correctly. And who suffers the most from all the shortcomings? The patient. I handed out a 4-question needs assessment that evaluated our teamwork and the need for daily huddle meetings. 18 people responded to this assessment. A little over 50% of the participants said that the team does not function effectively together and is confused with their role on the team. Almost every participant, 94%, said that huddles were a good idea. Even though the project was favored by most, it had both its restraining and its driving forces. Restraining forces included travel nurses, night shift staff, new graduates, negative attitudes, and nurse managers trying to take over. For example, the travel nurses, the night shift, and the new graduates, they didn't want anything to do with it. Travel nurses are only here for so long, and the new graduates, they just didn't want to make anybody mad. And one of the managers, she thought it was such a good idea that she was just going to say that it was her idea. But on the other hand, some of our driving forces included full-time employees. I had a motivated preceptor. Administration thought that it would increase patient satisfaction scores and patient safety, so they were right behind us. And lastly, it would increase our team morale, and that's exactly what we were looking for. Now this picture shows the side of the hospital that you see. Beckley ARH is a 173-bed acute care facility. It provides multiple different services. Now this picture shows the environment that I actually see. I work in a 30-bed ER facility. The nurse-patient ratio is 1:5. We have 1 physician and 1 mid-level practitioner. The chaos from this picture is real life. In any field, in any environment, you must have a plan if your goal is success. This slide shows some, but not all, of my committee members that help make the change project reality. Each of these individuals are RNs who are ready for the chaos to make sense. They helped make this project a reality. We held 2 meetings and discussed what options they felt would work to make our department the best it could be to benefit the staff and the patients. The huddle meetings will be daily and short, about 5 to 10 minutes. They will occur around 7:30 a.m. and be led by our CNMs. Night shift will also hold a huddle meeting around 7:30 p.m. We will have a timekeeper to keep us on track. All nurses, externs, and CNAs will attend the meeting. Every attendee is to stand to help keep the meeting short. Huddles will be used for education about new changes, ideas to improve the ER, stretching, a positivity exercise, setting goals, and delegation of assignments. We looked at both the benefits and the hurdles. Benefits include decreasing our tension, increasing cohesion, decreasing confusion, time for knowledge and education sharing, promoting teamwork, and initiating a game plan. Huddle hurdles include inconsistency, negative attitude, time constraints, patient acuity, as in when we come in and we have some high-risk patients, we may not have time to take a break for a meeting, and staffing issues. But I believe that the benefits largely outweigh the hurdles. And now I want to leave you with this single quote. The single biggest problem in communication is the illusion that it has taken place. So let's end this illusion and just huddle.